Good afternoon, or good morning for those of us viewing on the West Coast. My name is Rob Geen, and I am a fellow at the Bipartisan Policy Center. For the past 18 months, I have had the privilege of co-facilitating the BPC work group on child welfare financing and accountability, along with BPC fellow Hope Cooper. While financing and accountability may sound like dry topics, the reality is that how the federal government makes resources available to state and tribal child welfare systems and then holds them accountable has significant implications for the children and families the system serves. Today, I'm going to introduce several of our work group members who will highlight their consensus recommendations for bringing the federal child welfare financing structure into the 21st century and improving outcomes for children and families. In a moment, I'm going to be turning this over to one of our work group's co-chairs, Wendell Primus, who is a visiting fellow at the Brookings Institution. Previously, Wendell was the senior policy advisor to Speaker Nancy Pelosi for 18 years. Following Wendell will be Don Winstead, who is a consultant and child welfare financing expert. Don brings 4 decades of state and federal experience in all phases of health and human services policy and practice to the discussion. After Don, we will hear from Ron Richter, who is the CEO of JCCA. Ron is a former legal aid attorney, served as a family court judge, and was commissioner of New York City's Administration for Children's Services. Ron will be followed by Brian Samuels, the executive director of Chapin Hall. Previously, Brian was the commissioner of ACYF and the director of the Illinois Department of Child and Family Services. Next will be Sixto Cancel, the founder and CEO of Think of Us. Sixto Cancel is a nationally recognized leader driving systems change in child welfare, working across tech, service delivery, research, and data with state and federal policy to improve outcomes for youth and families. Following Sixto will be Reggie Bika, President and CEO of the American Public Human Services Association. Reggie previously served as the Executive Director of the Colorado Department of Human Services and the Secretary of the Wisconsin Department of Children and Families. After Reggie, we will hear from Ryan Martin, the Deputy Director of the National Governors Association's Center for Best Practices. Previously, Ryan spent 10 years as a professional staff member for the House Committee on Ways and Means and the Senate Finance Committee. Our last presenter will be Sarah Font, Professor of Social Work at Washington University in St. Louis. Sarah is a quantitative researcher with experience in child welfare systems, child protection, child abuse and neglect, and social policy. Her research focuses broadly on the role of government in protecting vulnerable children from harm through its child protection and justice systems. You can see their full bios as well as the rest of the work group members on the BPC website. I'll note that we encourage participants to offer comments today and ask questions in the chat. Though we will not have time today to respond, we will be documenting all of the comments and questions we received today, and we'll respond following the webinar. I'll also note that in addition to the blueprint, you will see several newly released documents on the BPC website that provide background to the blueprint's recommendations. You're going to see a link in the chat with a landing page for all of the materials. In early 2026, we will also be releasing a summary of the work group's discussions, which will provide much more detail of how work group members believe their recommendations might best be implemented. With that, let me turn it over to Wendell.
Thank you, Rob. Let me begin by saying it was a pleasure to co-chair this group. And as Rob introduced some of the presenters today, this was a very diverse group. We were diverse in terms of political background. I worked for Speaker Pelosi. My co-chair, Cassie, worked for Texas Republican Tom DeLay. We had child advocates. We had people who actually administered these child welfare programs. We had researchers. The point is, we were a diverse group, but it was a labor of love And I say it was a labor of love because our only compensation was lots of coffee and a little food, etc. But we all shared some concerns and values. We all cared deeply about child well-being and about child safety. And and despite our differences, we all came together because we recognized the importance of getting to a unanimous set of recommendations. And that means, Lord knows, I didn't get my way. I would have spent a little more on some of the poorer states, et cetera, et cetera. And every one of the members probably didn't get exactly what they wanted. Each of us would have had a different set of recommendations. But the point is, the main point I want to emphasize is that this is a unanimous set of recommendations, and we hope that Congress and state administrators, et cetera, can pick this ball up and actually implement this, because I am absolutely convinced that these recommendations will improve our child welfare system significantly. What I would like to do is make a couple comments. I mean, we often think of the child welfare system as the parents having some difficulty, poverty, in many cases, addictions that they've got to overcome. And it's those things that cause them to abuse their children. And, we have 3 million reports of abuse each year. But the other thing I want to comment on, is that sometimes there are children with severe deficits that would challenge the parenting skills of anybody. So it's really both sometimes parental deficits, sometimes really difficult children that are all part of our child welfare system. The other thing I really want to emphasize is that the child welfare system really has to depend upon other programs. In other words, if a mother or father has an addiction problem, we have to depend upon the healthcare system or the Medicaid program to help that person overcome those addictions. We have to depend upon the income support programs to actually get, in some cases of poverty, to get income supports to the family. We have to depend on other things to get prevention services, et cetera, out the door. But the key to all of this, the key to any successful administration is the staffing. And we spent some time in the work group talking about staffing, et cetera. We have some recommendations that you'll hear about later. But the thing I really want to emphasize is we say to the child welfare system sometimes that the decisions they have to make basically require the wisdom of Solomon. I mean, these are sometimes very difficult decisions, and it isn't always easy to see what the right decision is. And the last thing I'll say is the problems in our child welfare system are immense. I mean, we still have eligibility for 4E, dependent of one of our programs in the child welfare system relating to provisions of a 1996 Welfare Reform Act that hasn't been adjusted for inflation for 30 years. We have uneven federal financing. It finances some things and doesn't finance other things. It literally is a mess. And so those are some of the problems that this work group grappled with, and we developed a viewpoint, a blueprint, and we have 6 recommendations. And I'm going to now turn it over to Don Winstead, who will describe our first recommendation. Over to you, Don.
Okay. Thank you very much, Wendell. And it's my pleasure to present a little overview of recommendation 1 of the 6 recommendations in the report. The first recommendation is to create a federal formula grant by consolidating existing federal funds to better support core functions of state child welfare agencies. Our motivation here is to provide states with flexibility to design systems that meet local needs, invest in core capacities, and ensure resources that reflect need, and hold states accountable for outcomes. It may feel like a block grant, but it's not. We tried to combine some of the best elements potentially of a block grant with an entitlement program, and it differs from a block grant in that it's designed to grow over time to reflect differences in cost of living and also to recognize that not all states start at the same spot, that states start behind, and we want to, over time, reduce those inequities. While it's not an entitlement in the same way that 4E is an entitlement, one of the problems with entitlement programs is you have to wonder, what are you entitled to? And we've seen 4E over time erode, and we think this is a responsible and logical way forward. So what we're proposing is to take the major funding sources for child welfare, those being CAPTA, Title 4B, Part 1, Child Welfare Services, Part 2, Safe and Stable Families, and 4E foster care, both maintenance and administration, consolidate those into a formula grant. The formula grant would reflect historic spending, so no states or tribes would initially receive less than they would expect to receive if current law continued. So everybody starts at least where they are, and states should be expected to continue their investment in child welfare so that they would keep up the investment that they've made under the new formula grant. Next slide. States that have historically received a low level of federal reimbursement compared to states with similar level of need should receive an adjustment to their base allocation. And as Wendell said, the particularly Title 4E is tied to the arcane 1996 AFDC standard, and there was built into that a lot of inequity and a lot of historical problems that have been carried forward, and we would begin to address those problems so that things would be more relative to need rather than those historic inequities. The formula allocations would be adjusted over time to reflect changes in the cost that states incur in providing child welfare services, and existing federal accountability mechanisms should be replaced with an alternative that ensures transparency, focuses on child and family outcomes rather than process measures, and promotes shared responsibility between child welfare and other parts of the larger safety net programs. So with that brief overview, I'll now turn it over to my colleague, Ron Richter.
Good afternoon, and thank you, Don. It is a pleasure to be here. One of the, I think, key outcomes of our work together is the recognition that the partnership between the juvenile or family courts and a state's child welfare system needs to be stronger, better, and feature consistent quality communications. The two entities have to work together. And recommendation 2 is about creating a formula grant to support core functions of state and tribal family courts. The impact of this recommendation is really elevating the role that courts play in ensuring the safety, permanency, and well-being of the country's young people and thereby their families. And the limited court capacity in many jurisdictions has contributed to poor decisions and often create barriers for permanency outcomes for children and families. And anyone who has spent time in family court knows that there is constant pressure to enter orders to comply with federal law and also to best meet the needs of the children before the court And the information that is available is often not what we would want it to be. And the amount of time that it takes to get to decisions really harms families. And so the goal of this recommendation is really to create a grant that requires additional state investments in the court, a state match requirement, but a level that does not prevent states or tribes from using full federal allotment of funds. For anyone who's either run a child welfare system or sat in family court, you know that the marriage between those two entities is often determinative of how quickly and effectively a matter is disposed of. The recommendation, as you can see, has four parts. State and tribal courts receiving the formula grant will be required to develop statewide or tribal-wide family court plans in coordination with state child welfare agencies that document judicial practices that ensure families can appropriately and fairly participate in court hearings. 2B is perhaps the biggest change and critical for expediting and improving the quality of family court proceedings. Namely, states and tribes receiving formula grant funds must be required to ensure that all parents and children involved with child welfare agencies and family courts are afforded legal representation. This will save money because many matters won't necessarily need to spend too much time in court. When parents are represented and children are represented, there's an opportunity to get a lot of work done before a case comes into the courtroom. And that will help judges spend their time more wisely and foster far more productive conversations around how to ensure that a child and a family achieve permanency. The formula grant should require expanded data collection and transparency so that courts are going to be held more accountable. States and tribes receiving formula grant funds will be required to meet annual standards for the training of judges and attorneys that are specific to child welfare proceedings. And as a former judge, I can say that we don't often like to be told we need to be trained, but the reality is that matters that come before the family court involve so many issues: housing, immigration, obviously child protection, domestic violence, the list goes on. And judges sitting in those courts will do a better job and be more effective if they have training in the areas that come before them. And this is not training that generally gets accomplished in law school. So we really feel that coordination should be incentivized and that our judges should have what they need to succeed. This is about building core capacity to enhance the working relationship between our child welfare systems and our courts. With that, I will pass it along to Brian.
And recommendation 3 really is our best effort to leverage some of the important provisions of the Family First Prevention Services Act, but to extend it to a wider array of families. As most folks know, families in the child welfare system or that come into contact with the child welfare system bring with them a whole host of needs. And many of those needs have actually, they're often challenged by more than one need. And so part of what this committee discussed was the real need to be able to elevate the role of evidence-based practice across the entire continuum. So recommendation 3 really does focus on extending the availability of evidence-based interventions across the continuum and expanding the scope to both be able to achieve safety, permanency, and well-being under the 4E program. The 4E program, as indicated, is an entitlement, and as that is our understanding, recommendation 3 focuses on making sure that the families that they would otherwise come to the attention of the child welfare system, those that are directly involved in the child welfare system, those that have children with complex needs, would have access to these programs. So while we're not expanding the eligibility for 4E, we are talking about a more effective response to that group of families that are directly impacted by child welfare and are most likely to come to the attention of the child welfare system. So we would limit claiming under our recommendations to those families that are involved in the system or specifically have complex needs that are eventually or likely to bring them to the attention of the child welfare system. We also think that there's a benefit to defining evidence-based interventions to address the specific needs that families have when they come to the child welfare system. And the current mechanism, the clearinghouse, has a limited scope and focus of services meeting the needs of families. And so we, after much discussion, really did come to the conclusion that states ought to be able to reach a wider array of services, that states ought to have the opportunity to bring forward the best evidence for the interventions that they would like to use, and that they have the opportunity to make the strongest case they can for any individual intervention or any group of interventions. So our proposal would therefore eliminate the specific role of the clearinghouse and instead create an expert panel that could review the evidence put forward by each state, reach a conclusion about the quality and rigor of the evidence available under each of the proposals that states would bring, and then approve states' array of services that they would put forward. Again, not suggesting that clearinghouses are in and of itself ineffective, but given the wide-ranging nature of the interventions that would be represented here under a child welfare plan, we think an expert panel that has a little bit more flexibility, can be more nimble, can appreciate the nuances that often exist within a body of evidence. We ultimately think that that's the right direction to go in. And so we recommend an expert panel instead of the more traditional clearinghouse format. And then the third component of our recommendations revolve around both Medicaid and its interaction with 4E. In theory, Medicaid's coverage under EPSDT, in theory, would meet most of the needs required by a child welfare system in responding to the vulnerabilities that families bring with them. So theoretically, the policy exists for us to make sure that we've got the full array of services necessary to respond to the needs of families. Unfortunately, the policy as it exists today simply is inadequate to meet all of the unique circumstances that child welfare systems are challenged by. And so after much discussion, we recommended two primary issues underneath this consideration. The first one is for Congress to do a better job of defining the minimum continuum of medical and behavioral services eligible under EPSDT. In that circumstance, it would allow a child welfare system to rely on a core set of programming and opportunities that it could build case plans around, again, to address the wide array of needs that families have. Um, but in the circumstances in which EPSDT doesn't go far enough, our second recommendation focuses on creating an opportunity to commingle and to braid Medicaid funding with 4E funding in order to create the necessary continuum of supports that specifically meet the needs of families involved in the child welfare system. So, in quick summary, our goal here is take the evidence-based provisions that existed under Family First and extend them across all of what the child welfare system does. And in doing that, create the opportunity for states to bring the best evidence forward, to have it considered under an expert panel, and to dig into EPSDT in a way that allows us to establish a reasonable set of programs that child welfare systems can rely on, and at the same time create an opportunity to respond to the unique needs that families and child welfare have through a braiding of both Medicaid and 4E. And with that, I will hand it off to Sixto.
Thank you, Brian, and thank you to my colleagues on the working group. It has been an honor to learn from you all. I want to root my presentation in a quote from a young person and ground us in what we heard consistently from youth. Please take a moment to breathe, to hear the words of this young person. What foster care really means to me is that no one had an obligation to stay in my life. No child or young person should ever feel that way. That is the reality of many young people who are that is the reality that many young people are describing, but it doesn't have to be that way. When young people talk about permanency, they're not talking about a legal status. They're talking about whether someone is truly committed to them, not just today, but for the long haul. And they are talking about healing. Young people tell us that healing is about three things at once. Healing from the circumstances that brought them into foster care, healing from what happened to them while inside of foster care, and learning how to build healthy relationships despite the impact of family separation, all without the consistent support needed to actually heal. And we know from young people and from the evidence that healing happens in relationship. It happens when there is someone who stays. We often talk about the 3M moments, who they can call when something goes wrong. But young people just as often talk about the moments when everything is going right. Who is there when they walk across the stage at graduation? Who celebrates the new job? Who shows up when they buy their first car or moves into their first apartment? And too often, those chairs are empty. Before I go further, I just want to be clear. The recommendations reflect the consensus of this working groups. So you may hear me push beyond them in other settings, but today I want to honor and speak to what we collectively agree on. So let's dive in. First, we know when decisions are driven more by funding rules than by children needs. We know guardianship is the right fit, but relatives can't afford to say yes. We know adoption supports end too early. We know when the system is navigating reimbursement structures instead of centering them. So recommendation 4 responds by clearing these barriers, remove the disincentives, make guardianship a real and accessible option, ensure subsidies for adoption and guardianship never fall below foster care payments, and extend them to age 21. The goal is simple. Choose the right path because it is right for young people, not because the funding streams. Second, we know that when permanency does happen, support often ends far too soon. The case closes, but the trauma doesn't. The behavioral health needs don't. The stress the family is carrying doesn't. States already have tools to support family after permanency, and recommendation 4 pushes states to utilize Title 4E funds to provide most, excuse me, post-permanency supports, including mental health care and programs that help parent supports with substance needs so they remain stable. Proactively keep families understands what supports are available when they need to ask for help. Third, when permanency doesn't happen, do not pull support away. When Even if we remove every barrier and do everything right, some young people will still need to reach adulthood without permanency. For them, the message of recommendation 4 is clear. Do not let them fall off the cliff. First, extend foster care. Young people should always have the option to stay in or return into foster care until at least the age of 21. We know that staying in care until 21 is linked to better outcomes. Every young person deserves that runway. Second, modernize Chafee and ETV. Right now, there's a widespread dissatisfaction with the status quo. Chafee can be designed for a different era, and it can be designed to reflect adolescent development. Recommendation number 4 calls for modernizing Chafee and ETV. Provide developmentally appropriate supports that deliver strong results, offer real financial tools and resources for independence, not just short-term patches. Future reports can go deeper. The report will go deeper on these recommendations. But the core message is clear. We need a 21st century Chafee that actually meets the needs of young people. What young people are asking for across the country is all of this. The message for young people is simple. From young people is simple. Do not let us drift. Do not let the system run out of time on us. And if permanency does not happen, do not take support away. If we align financing with permanency, strengthen supports for families before and after permanency, and modernize Chafee and ETV so that truly reflects young people's need, then we can build a system that doesn't just talk about permanency, but actually delivers it and stands with young people, whether permanency happens or not. And I want to end the story with a shout out to the young people who created their own option, Cell Family. It came from not a think tank, but from young people actually co-designing. The reason I share this is because the most important line that I remember from this process is young people saying, the system keeps saying we need social capital, but social capital is just the system's consolation prize for when we don't get family. They are acting, they are building, they are also leading, and we get to do the same now. So let's be creative about how these recommendations can come to life. And I'll pass it off to Reggie.
Well done, Sixto. It's good to see you. Thanks for your work on this work group, and to all of my colleagues who spent a year and a half working together to come up with these solutions. You know, the one constant I think we can all agree on in our modern world is the notion of change. Science changes. As we listen to the voice of those that we serve, we know that current practices aren't necessarily meeting the mark, that communities and our own society changes our beliefs and thinking over time. This work group believes that federal funding needs to ensure that our child welfare system remains relevant, is adaptable, and is based on data, and that we must commit specifically in recommendation number 5, federal financing that allows for experimentation through states with the ability to sustain and to move about proven innovations. I've had the privilege of talking with child welfare leaders across the country, and they often tell me about frustrations of having to move forward programs that they know aren't effective anymore, but haven't heard of a better solution. That they have heard from their families that they need to do things differently, but aren't quite sure what that is. Or even worse, sometimes that they have a great idea, a promising practice, but they have no mechanism by which to test it, to adapt it. We believe that the federal government should play an important role in recognizing the importance of innovation, funding it, and holding all of us to a high level of quality in our innovation. And then lastly, expanding proven practices, proven ideas across the country so that more children can learn from these new innovations. We also recognize that experimentation needs to not just be based on large models, but to recognize that experimentation takes place in some of our smallest populations, rural communities, our tribal partners. And so we need to think about different ways that we can test new ideas, we can evaluate them with the rigor that is necessary, but also create mechanisms that allow for groups to come together, to work together to test these new ideas. Recommendation 5 gives us 3 specific proposals. The first is to create a new federal investment that's needed to support innovation. Cost-neutral approaches fail, we believe, to spur the types of innovation that's needed, not just today, but 10 years from now, 20 years from now, and 50 years from now. That states should be required to match federal investments in experimentation, but it has to be at a level that promotes robust participation among states, large and small, and with our tribes, again, large and small. And that priority should be given to states or tribes that commit to co-invest from other service systems to improve coordination between child welfare and the broader safety net. The power that comes about from a multidisciplinary approach to our child welfare system is the type of investments that we would like to, or experimentations that we would like the federal government to prioritize. Our second recommendation is the evaluation of newly funded innovation should be centralized, directed, and financially supported by the Department of Health and Human Services. We believe that making HHS responsible for selecting and paying for the rigorous evaluation of innovations that would be implemented will ensure that there are sufficient resources for high quality research. That we, through a centralized approach, would be able to limit investments to only those proposed innovations that can be effectively evaluated. And that we can enhance the ability for cross-site evaluation, having multiple jurisdictions testing similar or the same model to get more rigor and more data. And we can provide greater transparency, the cross-jurisdictional learning of ideas that may come out of states in the Northeast that would provide a great solution to counties in California if only we had a better mechanism of sharing those learnings and those ideas. And lastly, federal funds should be available to sustain successful innovations following the initial testing. We believe that to be effective through rigorous evaluation is wonderful and important. But if we can't figure out a good way to be able to share those learnings, to develop professionals, programs, practices, and policies based on those learnings, we've fallen short. And so this new mechanism, this new approach would provide resources to make certain that that can happen consistently for years to come. It's now my privilege to introduce our colleague, Ryan Martin. Ryan?
Thanks, Reggie. It's great to be part of this group for the last year and a half, and it's been great to come together and discuss a huge range of recommendations and zero in on those things that we really do agree on, and find the ways that we can come up with recommendations that will help improve the lives of children and their families. And I think this is a great example of that in recommendation 6. So lots of our dialogue was focused on what is the correct role of the federal government. States bear a lot of this work, but the federal government can play a key role in certain aspects. And as we've seen in earlier recommendations, we recommend simplifying the financing, simplifying some of the accountability, and really focusing on outcomes. And 2 areas that we felt strongly that the federal government could play a very helpful hand is both in workforce. We see high caseloads, high turnover, lots of administrative work. This has been a long time problem. States haven't been able to solve this on their own in most cases, and so felt that that was one area that the federal government can get involved. And the second is on data and technology. Funding exists to support states' data systems, but it's been difficult for them to build and maintain these high quality systems. And it's also not capturing, in many cases, the wealth of other information that could help inform their decision making and policies and practices. And so instead, we focused a lot on measuring process or compliance with rules, not focused on results. So I think, looking first of all, in terms of the National Child Welfare Workforce Academy. So, they need federal coordination and support to find a way out of this. This has been a challenge for a very long time, and there haven't been many great solutions about how to address the challenges with the workforce. We really want to make sure that the staff are getting the specialized knowledge that they need to be effective. And we think it's reasonable to believe that better training plus better support can yield better outcomes. We just need to systematically try different approaches, measure those outcomes, and steadily improve over time. So part of this recommendation is really making sure there's clear skills and certifications and development around programs that are based on which things are most important for these individuals to have to work effectively. One of the examples that we looked at here was the Bureau of Health Workforce that has for a long time offered various loan and scholarship programs, as well as grants to organizations to support training. Recommendation 6B regarding the improvement of, let's see, recruitment and retention of child welfare workforce through financial incentives. So again, there's tools used in various fields that include loan forgiveness or tax benefits or other things. And there's a real need to better measure to understand what will make the difference for these workers. It's not just about getting people, through social work programs, but making sure they have the skills and training to help those that they're working with and make sure those who are taking the jobs feel empowered and that they stay. We know states, it's really difficult to make progress with the high turnover that most of them have. And we need to make sure that they get the help they need, getting the right people with the right skills and keeping them in those roles so we can benefit from their expertise over time. And recommendation 6C, talk about the creation of a national child welfare data measurement and technology center. The focus here, this is not big data. This is not putting everything in a big warehouse where someone can go through and analyze the information, but it's about helping states maintain quality data and also identifying other data they can use to inform their policies and decision making. Just a quick example, yesterday, I have a folder here at work that has dozens and dozens of policy documents in it. And I spent 5 minutes and created an AI agent that can surface any information from any of those documents that I need very quickly. I think very simple example of some of the ways that we can leverage technology, both things that already exist and things that are coming available now to significantly streamline the administrative workload of the staff and let them do the jobs they were hired to and the jobs they want to do, which is helping children and families. So I think the federal government can really play a role here in identifying across states things they've found to be successful, helping to provide the structure and framework and identify ways that they can take on more tools to do this that can again result in better decision making, less administrative work, and really help maximize the benefits of technology and data. And with that, I'll turn it over to Sarah Font to close.
Great. Thank you. So is the right framework for reform, even if we might quibble about some of the details or we don't love every provision. So the main thing I want to address is why we chose to expand so much flexibility to states and why we didn't remain wedded to the accountability and evidence thresholds of the past. You might be thinking, where is the accountability? Are we just going to let anyone do anything they want with federal funds? So let me give 3 answers. So first, I think there's a consensus in the working group that the problem isn't that state leadership doesn't care about kids and they're just not trying very hard. It's not that they just need the federal government to strong arm them into doing the right thing. It's really a problem of whether they have the adequate infrastructure to do the work. And so the lack of functional technology and the severe and pervasive shortage of a qualified workforce were the primary barriers that we saw to better child protection and child welfare systems. And if we've learned anything from the past 3 decades of what we've been doing, no amount of federal monitoring and micromanaging is going to create a qualified workforce or a functional data management system. So our recommendations really emphasize the capacity for the federal government to facilitate the production of knowledge and access to technology by leveraging economies of scale and to incentivize innovation and cautious experimentation. Second, at best, our existing performance measures serve to tell states what they already know, that they're not adequately serving children and families. But at worst, they induce perverse incentives and distract agencies with box checking tasks that bear little relevance to child safety, permanency, or well-being. You might wonder, couldn't this group come up with better boxes to check, better performance metrics? I'll be honest with you, no. I don't have time to get into all the reasons for that, but it's just really hard to measure the things that we really care about accurately. And when we get those measures wrong, we can induce negative consequences. Third, and I really can't overstate this, we simply don't know as much as we think we do about how to prevent maltreatment, how to assess safety, how to protect children within their homes, how to heal children who have been victimized, and how to rehabilitate parents who engage in abuse and neglect. So I came to this working group both as a former CPS investigator and as a researcher. And I believe in evidence and accountability, and I understand how hard this work is. But let's be honest about what the state of scientific evidence really is. Most of the programs we have to offer families register small improvements, if any. Many of the products and tools we use to assess safety and risk have let us down. And many of the system's default assumptions that avoiding intervention is good, that kinship care is always best, that early intervention or earlier reunification is better, that adoption works out, like all of those things are complicated and much more nuanced than a yes/no checkbox. So when we remove that nuance and pressure states to work towards lists of outcomes without context, we can cause harm. So for those reasons, the recommendations of this work group are exceedingly humble. There's no silver bullet in any of these. But these recommendations collectively seek to incentivize experimentation, adaptation, and innovation. There's an understanding that in too many areas, the best that our systems have to offer is simply not good enough. And as such, forcing states to chase the shiniest objects on display today will guarantee that they're antiquated tomorrow. So let me close with what I think is the most important thing that I want you to take away from today. The flexibility that these recommendations would give states is not free. The increased flexibility is in exchange for unprecedented transparency. And without that recommendation for greater transparency, I wouldn't be here making the case for these recommendations. Community members, the media, even policymakers and researchers really have very little insight into how their local child protection agencies actually function. And when child protection operates under a veil of secrecy, even the smartest among us is going to misdiagnose problems and push solutions that may not be relevant or effective and that are based on anecdotes, partial information, and outdated assumptions. So by requiring greater transparency, the federal government can democratize information. That is, empower states and local stakeholders with the knowledge they need to promote change and accountability in their own backyards. Thank you, and I'll turn it back over to Rob.
Thank you, Sarah. So I just wanted to close and express my deep appreciation for the work group members. Wendell joked that all we offered was coffee and food, but that's actually true. And it was remarkable the number of hours that work group members provided to this process. It's been a blessing to be part of those conversations. And the appreciation is enormous. I also wanted to be very clear that we chose the word blueprint as a work group intentionally. Work group members are humble. They recognize that they don't have all the answers. They do believe they understand the problems pretty darn well, and they're looking for others to comment on potential additional solutions. So there's going to be a lot of effort in the coming year to disseminate all this information, to hear from different parts of the community. What did the work group get right? What did the work group overlook? What are better ideas the work group should consider? We're going to spend all of next year getting all that information from different audiences and putting it together and bringing it back to the work group. So you can count on us taking this show on the road. Work group members have already volunteered to join conferences, webinars of organizations. If you have a membership group that you want to engage this work group with, we are there to do that with you. And then finally, let me say something about the details. There are a lot more details that were discussed. It is hard to provide this level of information in a quick time frame, but we want to focus on some of the high-level concepts while also going into all of those details in future documents, which will lay out a variety of different options for how each of these recommendations might be implemented. With that level of detail, we can also provide fiscal estimates of what some of this may cost. The good news is that the recommendations are scalable, and so they could be done at varying different levels of cost. There are areas where workgroup members would like to see new investment. There are areas where there's potential for cost savings. So with that, happy holidays to everyone, and thank you for tuning in.